Hello, facial palsyers. It's Monday. This weekend I attended a very great seminar, conference, symposium, whatever you want to call it, on the facial nerve in Santa Monica, California. This was my second time there, and it was pretty amazing. The level of expertise that everybody that presented had on the facial palsy was great. Amazing surgeons from all over the country were there to present, and it was great to have some great conversations with some of them. And that brings me to mention one thing that was agreed upon at this conference is that the management of facial palsy and particularly synkinesis is a chronic condition and a lifelong basically medical management. Just like, if you will, you manage high blood pressure. Generally, when you start having high blood pressure, this is something you're going to have to manage all your life with diet, exercise, and medication. And the management of synkinesis is also a lifelong endeavor. Synkinesis is not something that goes away. The intensity and can be very much reduced and under control with the correct management of facial therapy, Botox, as well as some surgical procedure. That is to say that synkinesis, you don't wake up one day and synkinesis is gone. The intensity is going to vary a lot depending on various things in your life: stress, cold outside, how much you're stretching, are you really compliant with your stuff. But it is a lifelong management, and I think this is something that we probably don't talk enough with the patient. And that is very important, is that once you have synkinesis, this is something that you're going to have to deal with for the rest of your life. But with the correct treatment, and this is where the specialists are coming in, between the surgeons and or head and neck reconstructive surgeon and doctors, as well as facial therapists. This is where we all come in. And this is a multifactorial, multidisciplinary diagnosis, that will be treated. So I think it's important for everybody to realize that, and this is something that I think as provider we have to be very clear about, or clearer than we have been in the future. And this is why I generally, when I see somebody with Bell's palsy, even within the first 3 months, even when they're still in the flaccid paralysis stage, I do educate them with synkinesis, which is a possible complication. We know that about 65-70% people recover without complication, but that leaves the other third of people with more difficulties and generally synkinesis. So I think the more aware, the more educated you are early on, even if you might not have synkinesis, but especially if you will, I think that's a great thing. And I think it can help understand and know possibly what to expect. And I think that's more reassuring. And I also want to remind people that synkinesis is the second best thing that could happen, because the other thing, you could also have no facial nerve function return and no signals. So that is much worse and involves much more complicated surgeries, and I think everybody should also be aware. So I hope that was helpful, and I encourage all of us providers to really mention and discuss and make clear that this condition is a chronic condition that we are treating. This is not something that just goes away from one day to the next. So hence the difficulty and complexity of facial paralysis treatment. Have a great week. Take care.